For my intended career choice, I've chosen an OBGYN nurse practitioner. So, the scope of practice for an OBGYN nurse practitioner is to perform checkups on expecting mothers and their babies, as well as give advice and tips to expecting mothers on how to stay healthy, such as what their diet should be and what kind of vitamins they should be taking. They'll also give the mothers like a list of signs and symptoms to be aware of while pregnant, so that they know if what they're experiencing is normal or if they should be concerned. For the gynecology aspect of this career, they will perform pap smears and pelvic exams, prescribe medication and birth control, as well as perform minor procedures such as inserting certain birth control, such as the Nexplanon and an IUD device. For diagnosing, they'll usually diagnose sexually transmitted disease or other reproductive illnesses, such as endometriosis or even breast cancer. They will also provide treatment plans for these patients, as well as refer them to other specialists if they need a second opinion or just need another pair of eyes to look at the patient's symptoms. So, the day-to-day duties of an OBGYN nurse practitioner are, of course, to see patients for a variety of reasons. Some of these would be fertility counseling, routine checkups, such as like wellness checkups for women, family planning, and also prenatal checkups for pregnant women. They will also review test results that have come in that they have previously ordered, some of which could be blood tests or STD tests, and then they will, of course, refill prescriptions as well as refill birth control prescriptions. So, the work setting for a nurse practitioner can vary depending on where they are employed. They will always be working directly under a physician, but if they are working under only one physician, it will usually be in a smaller practice. But they can also work in a hospital, and in that setting, they will be working under a variety of physicians, not a specific one. But whether they're working in a small practice or a larger one like a hospital, they will always be working alongside with the registered nurses. And they may also have a personal medical assistant that will help them with their paperwork and going through lab results and assigning them to which patients and sort of summarizing them so the nurse practitioner doesn't have to go through every single piece of paperwork. So the education requirements for this career would be first to receive an undergraduate degree of Bachelor of Science in Nursing. They would then, after graduating from nursing school, take the NCLEX exam to become a registered nurse. Then the next step in their education would be to go to graduate school. For graduate school, there are 2 degrees that they could choose from, either a Master of Science in Nursing or a Doctor of Nursing Practice. The DNP degree has become more popular, so that is the most common degree that nurse practitioners currently have. After that, they will need to take the certification exam, and the National Certification Corporation is the corporation that provides the certification exam specifically for women's health, so that is the one that I would most likely take if I was to specialize in OBGYN. And then, of course, the continuing education classes and exams are every 4 years, but that's specifically for Florida. The number of years will differ by state. So for Florida, there's also 24 hours of continuing education courses in specific areas. These are all mandated and constantly change due to the decision of the Florida Board of Nursing. And then all of these continuing education courses must be taken through an ANCC accredited provider. So an example of one of these accredited providers would be the American Academy of Nurse Practitioners or the National Association of Nurse Practitioners in Women's Health. So, the summary of my timeline for how I plan to pursue this career would first to be to graduate from USF, which I'm planning to do this fall, so in December. I will then attend an accelerated nursing program to earn a BSN because I'll be graduating from USF with a health science degree, so then I will need to earn my BSN. From then, I will work for a year to gain as an RN to gain hours and experience to then apply to a master's program or the Doctor of Nursing Practice programs. So then I will obviously apply to those programs, go to graduate school, and then graduate from one of those programs. Then I will take my certification exams. I will then, after I hopefully have passed my certification exams, I will submit an application to the Florida Board of Nursing to become licensed in Florida, and then I will be able to start practicing. And here are my references. Thank you.